we're going to go ahead and get you all your stuff. We just want to make one last offer to you, which is the fluoroscopic knee injection program. Now, this program is amazing. 92% of the patients who've had this fluoroscopic knee injection have reported improvement. They love it. Medicare, Medicaid pays for it, as well as private insurers. They all reimburse on different levels, ranging from about $3,000 to about $7,000 per kneecap. That's how we get the number of $5,000 on average per kneecap. And we show you how to do 20 of those a month, one a day. That's about $100,000 to your practice. All the training, once again, we fly in, we show you exactly how to work with our protocol. It's fluoroscopy. We're using fluoroscope, which is a blue contrast dye. We put it into the synovial sac. Using our C-arm, mini C-arm X-ray, we're able to tell exactly where to make that injection at. We have 92% more accuracy. That's what we're looking for, is to not be feeling around and hoping and guessing we get it right, but we're actually able to light it up with the fluoroscope so you can exactly see where to make the injection, and we're getting 92% better results from that. It's the Suparts, which is a chicken-based enzyme, so it's organic. Most of the knee injections are, synthetic, cortisones. We steer away from that. We try to keep it organic, and unless you got a chicken feather or egg allergy in your patient, these things work amazing. One of my doctors, he's telling me, on the first or second visit, the patient was coming in a wheelchair. On the third, fourth visit, they come in a walker and a cane. On the fifth visit, they come in walking. So you're able to see and remember why you got into this profession, because you're here to help people. And that's what we're here to give you, every tool, access to every resource to help the whole health condition of urban and rural America. All you got to do is click on the link below. You can get more information about how the Suparts works. We actually save you money on your supplies. Most of the time, you're a little upside down on your supplies. You actually make a little money through our supplier. So we get you the best pricing on your supplies, all your gloves, your injections, as well as your stem cell and platelet-rich plasma. So that is an option for you as well. You're learning exactly how to do these injections. So if you want to, you can graduate to our stem cell therapy program. And that's a cash-based program. You'll love that part, where you're able to have different streams of income coming into your practice that are not closely related to insurance reimbursements. That helps you with your financial strategy as far as your practice goes, where you don't have everything connected directly to insurance reimbursements. That's really where the space you want to be at. There's nothing wrong with having a mix, having Medicaid, Medicare. There's nothing wrong with having private insurers, but it's something to be said about having cash. Okay, that's the thing, and we help you get it and give you other approaches to getting there. If you want more information on that, the program, it costs roughly around $3,500 per month to have the program, to finance the equipment, and have our protocol. And you're gonna make $5,000 average per kneecap. We're gonna show you how to do 20 of those every month. Lowest participating practice in the last 12 months of our program, the lowest earning practice made $1.1 million. This is something that really can help bolster your practice as far as revenue goes. And if you got any questions on that, if you want to know how you can get set up, click on the link below and we get started. Welcome to Study Club.
So the questionnaire is not for the doctor. The questionnaire is for the doctor to give to the patient. If they circle yes to any of those questions on the questionnaire, the doctor can just pretty much count on making $3,200 if they have Medicare, no secondary. So go back to the doctor after 2 or 3 days, maybe even a week of handing that questionnaire out, and the receptionist goes, yeah, we have 15 of these, or we have 20 of these. Well, what's 20 times 3,500? What's 20 times $3,000? That's $60,000. So right now, in paper, like pieces of paper, you have $60,000 of money if you call those people in and they elect to go with the knee injection. That's if they have no secondary. If they do have a secondary, it's $5,000. If they do DME, that's another $1,000. Actually, it's $6,000. So every time somebody answers yes to one of those questions, you can just go cha-ching, 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 because that's money. So the questionnaire is not for the doctor. The questionnaire is for the doctor to give to the patient.
Hello, my name is Dr. Glenn Aki, and I'd like to take a couple of moments to tell you about some additional services we started providing in our office and how it's worked out for us. About 1.5 years ago, we started looking for different procedures and services we could offer to our patients, to increase our patient base, to fill the gap that the changes in the healthcare landscape have caused over the last several years. And what they've developed is a program for the conservative, non-surgical treatment of osteoarthritis of the knee. At first, when we looked at it, we were impressed with it, but it wasn't until we started talking to other doctors that we found out how effective it was. They've been wonderful with us. Everything that they've promised, they've delivered on. But above and beyond that, the procedures that we do with these patients are very, very effective. The success rate is extremely high, higher than we could have imagined. So if you're looking to increase any of your services, I would highly recommend you call Lance. The integrity of him and his company is unmatched. Since I've been in practice a little over 30 and a half years now, there's not a company I've dealt with that has been able to deliver on what they promised, like this company has. Thank you.
Hi, I'm Dr. Vincent Domingo with Performance Health Medical and Rehab, and I've had the pleasure of working with Lance and Carlos with IPS and their high algon program. I have to say that their program has been nothing but the best for my patients. Their help and advice and their program itself have proven a level of quality that I couldn't imagine having before them. Just to read a couple quotes from a couple of our patients. Edward S. wrote, "After going through the hyaluronic injections, you have completely changed my life. I know how I feel. I could go anywhere without the fear of falling or climbing stairs." Doris L. wrote for us, "Hyaluronic shots were very successful. Started with severe pain in the knees and activities were very limited. After the series of 5 shots, I am able to work, exercise, and play golf with no pain. I've had hyaluronic shots previously, and I find that they last approximately 1 year. I'm back to being able to do whatever I need. Thanks to everyone, the very pleasant staff to work with." So you can see a lot of the results that we get and provided by their quality program, the detail involved in it, using the fluoroscope for the imaging, using their marketing to just bring people in, using the physical therapy, the knee braces. The detail of the program has been very helpful for my patients. I am happy with the results, and the personal and quality service that Lance and Carlos have been able to provide me have been able to help grow my practice.
Hi, my name is Dr. Cal. I practice here in Woodstock, Georgia, Advanced Health Solutions. I've had the opportunity to work with Lance Liberty for many, many years, well over 12 years. The guy is a genius, and his business model is magnificent. From a market standpoint, I don't know that there is anybody better than him. He's incredibly knowledgeable in all procedures, and he had recently come to our office, educated us on the use of the C-arm. We purchased the C-arm through him. He trained us and our medical director and a physician assistant on the use of it, the marketing for it, and his protocol were right on the spot. I highly recommend him as a resource to you, as a marketer, as a person that you can deal with on a regular basis, business standpoint. Very, very highly recommended. I appreciate your Lance.
My name is Dr. Abram Weinberg. I'm a chiropractor practicing in Maryland. I've been practicing for about 28 years. And earlier this year, the end of last year, is when I integrated my practice to become a chiropractic medical practice. And I really needed help with that, so I turned to Lance Liberty and his company to help me. Now, I didn't really know Lance. I had heard some good things about him, so I figured I'd give it a shot. And I am really, really glad that I hired him and his company. Lance is the most honest, ethical person that I have ever met. I have used many practice management groups over the years, and a lot of them I've been burned with. And Lance, even though you sign a contract, he does everything in his power to make sure things are done properly, to give you a good outcome, and he always does the right thing. He always does what's best for his customer, meaning, in this case, me. I, of course, had to pay a fee to join with Lance's group, but I believe I've earned that feedback many times over through his ideas. He thinks outside the box. He looks at things from many different angles. He's an extremely intelligent person, and he knows what he's doing. He has a lot of contacts all throughout the country, and he has turned me on to other services, and he has, gotten me discounts on supplies and so forth. Everything has just worked out fantastic with him, and I would definitely renew my contract once it's up. And I urge anybody who's even thinking about whether they should sign up with Lance's group or not, I believe you should. Thank you.
Hi, I'm Dr. Tom Federico from Advanced Health Solutions, the medical director here. I want to make a little note for you about Lance Liberte at Prime Business Solutions. He's been an awesome person to talk to and help us with training on this beauty right here and dealing with injection therapy. He's been quite helpful. He has a lot of knowledge. He's had a lot of research that he's done. He's pretty well versed in all the things that need to be done. His protocols are awesome, and he gets everything set up for you, so I couldn't be happier with the things he's done for us at this point. Thanks a lot.
Hi, I'm Dr. James, and I'd like to give a professional recommendation to Lance and his team. I've had the opportunity of knowing Lance since 2004. I've been able to see him grow tremendously over the years, and have seen him help countless of doctors grow from ground up and been extremely successful. Lance has been instrumental in my marketing and helping us to continue to grow. I've spoken to him throughout the years on and off, and every time I needed advice, anytime I needed one of my advertising freshened up, he's always come back with something that completely blew my mind away. He's very professional. He's always returned my calls and always been prompt on returning all my requests. I highly recommend Lance and his team, and I wish everyone the best of luck and success.